In this video, we're going to introduce the Health Supply Chain Leadership Questionnaire, an innovative way to test your supply chain leadership skills from Pamela Steele Associates, the Supply Chain Capacity Development Company. We're going to cover what the purpose of the Health Supply Chain Leader Questionnaire is, the different applications it can have, how it's been designed, the competency framework that it uses to test a person's supply chain leadership skills, and what kind of information you'll find in the personal feedback report you will receive after you answer the questionnaire. So, what is the purpose of PSA's Health Supply Chain Leader Questionnaire? Well, if you're an individual taking the questionnaire, it will provide you with three things. 1. It will enable you to benchmark your technical and management skills and competencies against other health supply chain managers. 2. It will help you understand how your competencies are affecting your performance as a supply chain leader. 3. It will help you understand what your strengths are and also what limitations you might have, so you'll know what skills you need to work on. If you are an organization working in the area of health supply chains, you can also benefit from PSA's Health Supply Chain Leader Questionnaire. It will allow you to make better recruitment decisions by providing you with information about a particular candidate's competencies and by being the foundation for conducting a competency-based interview. It will also help you maximize the team you already have by allowing you to benchmark your staff and by telling you which members of your team might be ready for promotion and which ones need some help to develop their skills. The questionnaire results can also help you put together an effective personal development program that is tailored to the precise needs of your team. That gives you a pretty good overview of the different benefits the Health Supply Chain Leader Questionnaire can provide, but perhaps you're still wondering if it's going to be useful for you. The questionnaire has many applications. Are you involved in running training and development courses? If you are, you can use the questionnaire to help your participants understand their training needs. Are you a senior manager looking to coach and mentor a team member? You can use the questionnaire to get a clearer idea of where you should focus your work. The questionnaire will also help if you're running team-building events or designing tailored training for a particular group of supply chain professionals. Finally, you can sharpen up your recruitment process by using the questionnaire to carry out competency-based interviews with your applicants. So you're a health supply chain manager. How has the PSA Health Supply Chain Leader Questionnaire been designed to assess your health supply chain skills? The assessment is based on the Competency Framework for Managers and Leaders of Health Supply Chains, developed by the People That Deliver (PtD) initiative, which assesses health supply chain professionals against 3 different scales relating to this framework: the 6 key areas of supply chain management, 20 technical competency clusters, and 25 management competency clusters. During the questionnaire, you are presented with 234 statements about supply chain competency areas. You respond to these statements by choosing a response on a 7-point Likert scale. When you're done, your responses are compared to those of other supply chain professionals from across the world, and the questionnaire gives you your own result as reported in 3 scorecards. Let's look a bit more closely at the PtD Competency Framework on which the questionnaire is based. The framework covers technical competencies and management competencies in health supply chain management. On the technical side, there are 4 high-level categories: selection and quantification, procurement, storage and distribution, and use. On the management side, there are 2 categories: managing resources and professional and personal skills. Selection and quantification and procurement are technical competency areas. A manager needs to be able to select and quantify the correct supplies for their particular supply chain situation. This involves selecting the appropriate product, defining the specifications for that product, and forecasting product needs. At the same time, a supply chain manager needs to be able to actually procure the supplies required, which involves quite a lot of things, managing procurement costs, building and maintaining relationships, dealing with contracts and risk, quality assurance, and preparing for emergencies, to name a few. A supply chain manager's job is not over when the supplies are received, however. Once the right supplies have been obtained, they need to be stored and distributed before actually being used. These are important areas of technical competency for a health supply chain manager. Managing the storage and distribution of the supplies includes skills areas like inventory management and managing the transportation of commodities. What about use? Well, ensuring the best possible outcomes for the end users of the medical supplies is what health supply chain management is all about, so a manager needs to understand how the medical products are actually going to be used. Technical skills are not the only skills the PtD framework covers, though. Management skills are important too. After all, we're talking about health supply chain managers. Managing resources refers to managing money and people to ensure the supply chain system works effectively. As you can see from the left-hand column, these are important skills, like managing projects, overseeing human resources, and managing outsourcing. Professional and personal management is what it sounds like. It covers things like communication, leadership, and ethics in the supply chain, the kinds of personal and professional skills a health supply chain manager needs in order to deal with the challenges involved in the health supply chain. PSA's Health Supply Chain Leader Questionnaire is about helping health supply chain managers identify where their competencies are strong and where they need improvement. That's why when you complete the questionnaire, you will receive a personal feedback report at the end. This provides an overall summary score showing your results against the 6 key areas of health supply chain management. It then breaks this down into a bit more detail, showing your results against the technical side of the job and against the management and leadership side. Finally, the report provides self-development advice tailored to you. This is designed to help you pursue the best path for developing your competencies. The scorecard you get when you complete the questionnaire allows you to see how you compare to others. There's a lot of numbers here, but it's simpler than it looks. The standard 10 or STEN score corresponds to your position relative to other people. For example, if you get a score of 5, you are of average proficiency. That means you are more competent than 40% of the overall group. It also means you're less competent than 60% of them. Moving up the STEN score signifies being increasingly competent in comparison to your peers. So if you achieve STENs of 9 or 10, for example, you're more competent than 99% of your peers. That's outstanding. This is all a way of allowing you to see if you're making the grade or if there's room for improvement. This extract from the summary scorecard in the personal feedback report is about giving you more detail about your performance. Here, the 4 technical areas are being looked at. Remember, there are 4 key technical areas and 2 key management areas in the competency framework, making 6 in total. This particular person scored 8 on selecting health commodities, which is very good, but their competency in regard to how the commodities are used could do with a bit of improvement. The arrows, by the way, indicate that this person might be a bit better or a bit worse than the score actually indicates. These are called confidence bands. The final section in the personal feedback report gives advice on self-improvement. As you can see, there are a few different ways in which we can improve our competencies as health supply chain professionals. First things first, review the results of the PSA Health Supply Chain Leadership Questionnaire. As we've seen, this makes clear where a person has strengths and where they might need improvement. Once we know this, we can set learning goals to address these limitations. We can also build on the strengths we now realize we've got, and even create new strengths. Of course, we've got to match all this to the job we're doing, and the one we might be aiming to get soon, So we've got to think about which competencies are most important for our current job and which competencies are going to be important for the next level. A good idea for improving our skills is to develop SMART goals, goals that are specific, measurable, agreed upon, realistic, and time-based. Writing these down in a personal development plan will help us achieve them. Finally, being a health supply chain manager is a journey of discovery. There are always new things to learn. It is important that we structure our learning, though, to make sure we progress in the right direction. To that end, we should identify a mix of learning activities that will help us achieve our professional development goals. Finding the right solutions that match our own individual learning style is important. We can use formal types of learning, such as PSA's Health Supply Chain Management courses, or we can use more informal activities, such as coaching, mentoring, shadowing, reading, and even browsing the web. Anything that helps us progress to the next level, which is what PSA's Health Supply Chain Leader Questionnaire is all about.